Hey everyone, and welcome to this edition of Comet Conversation. And this is our first edition for the 2021-22 school year, and certainly is our pleasure to have with us on today's program Dave Covell, Lorain County Public Health Commissioner. First of all, Dave, thank you so much for being with us.
Great to be here.
Dave, if we could kind of start out, if you could maybe just share a little bit about your relationship, not just with the Amherst School District, but with school districts across Lorain County.
Well, you know, we've always had a relationship in terms of school nursing and in other areas where we kind of help the schools, you know, in normal times, I guess I'll say. But these have been less than normal times, that's for sure. So for the last 18 months, I've really been meeting pretty consistently with the superintendents to kind of just talk through what was going on with COVID, give updates, and then actually, you know, again at the beginning in 2020 when we, you know, the school shut down, and then we were talking about how to reopen and kind of all the designs, and ever since. And so very often, you know, usually once a week, but sometimes, you know, during the summer we delayed a little bit, and every few weeks, but we've been in pretty constant communication between the superintendents and the health district.
Yeah, thank you for that. And I know you've always, we appreciate your willingness to take calls and questions, not just at those weekly meetings, but I know you and I often talk on 2 or 3 different occasions during the given week, and we thank you for that. Maybe if you could talk a little bit about, you know, this pandemic. We've been in the midst of this thing for about, 18 months now. And if you could maybe talk a little bit about where Lorain County stands right now, maybe as it relates to the rest of Ohio, and if you could maybe speak to a little bit about what you're seeing at our Lorain County hospitals.
Sure. So let me give you a little sense of history without going into a big history lesson here. But so remember at the beginning, we began to see in Wuhan, China, what was going on, you know, at the end of 19, and then at the beginning of 20, we began to see it come into the United States. And just to give you some perspective, you know, our cases at that time, we were worried that the case count would start to go up, and we'd have enough people going to the hospital that we're going to flood the hospitals. And so that's when you heard a lot of Dr. Amy Acton and Governor DeWine and a lot of folks talking about bend the curve and so the hospitals can be ready. And so they had plans to, in case they were going to overflow, but they hadn't really gotten the plans out and really made sure they were functional. And so we did a great job of that here in Ohio. And so cases dipped in last summer, and you know, like you'd expect because most people are outside. And then in the fall, we were a little worried that it could come back because, again, without a vaccine, without any other way to kind of defend ourselves, this novel virus, this new virus, we really couldn't, our bodies couldn't fight it. And so last fall is when we had our peak. We peaked at December 10th, that week of December 10th, and we had about 1,500 cases per week at that time, which is an unbelievable amount. But luckily, you know, the way the schools were designed, it really didn't spread very much in the schools. It was really more outside areas where it spread. We'd have a few cases in the school, but again, most of that came from outside. And then vaccine came out, and so we had the opportunity to protect grandma, because that's what we were really concerned about. Remember, older adults, people with immune compromise, those had the worst health outcomes. And so we did a good job of that. And so as we moved into the spring and began to vaccinate folks, and it got opened up for even younger people, people got vaccinated, and that's when you saw, again, a huge dip in the amount of cases. So just recently with the Delta variant, that variant's a little more contagious. Not really more deadly, but just more contagious. It spreads faster. So unvaccinated people are really coming down with COVID, and that's really what's happened significantly here. Now, we are high in terms of cases, but those cases are just about 450 per week as opposed to 1,500.
And this is Lorain County?
Yeah, right now in Lorain County, we're about 450 per week as opposed to 1,500. So again, we're a third of that, but we're significantly higher than we were back in June and July of this year, where we were really down to, you know, 10 or 15 cases in a week. So again, as we move through this wave, and you could probably ask me, but I wouldn't know the answer to why does it come in waves? The history of pandemics come in waves. Ever since smallpox and, you know, all the old pandemics that have gone through always came in waves. And so I don't know, it's something about human nature or whatever. But and so as this wave moves past us, the more people are vaccinated, the less impact it'll have. So to get to your question about how's the impact going right now, the one difference between now and the fall is that when we look at case count, we know that later on, after the case count goes up, we see hospitalizations go up, and sadly we see deaths go up. Now, because so many people are vaccinated now and some other people have gotten it naturally, we're really seeing less of that impact. So the hospitals do have more activity going on, but they're not nearly what they were in the fall, in terms of being overwhelmed. But they are concerned, and they're worried that if that case count keeps going up, could we see more and more of the hospitalization? And that's really the concern. Luckily, even if you have a breakthrough case as a vaccinated person, you actually don't usually have bad health outcomes. You rarely go into the hospital and certainly don't die. And so that's really the best kind of protection, if you will, is to get vaccinated.
And I know you've mentioned before that in general, Lorain County is in a better position than most of the counties in Ohio. Is that correct?
Yeah, so if you think about this, if you have a higher vaccination rate, you actually have that envelope of protection, if you will. So that's why right now you saw Florida really was struggling, and Texas was really struggling, and actually some counties in southern Ohio that have very low vaccination rate have really been struggling with this, because again, in smaller communities you have less hospital beds. You also have, if you have a less vaccination rate, you could actually get more spread going on, and that's what's going on in many counties in Ohio. Luckily, up here in Northeast Ohio, including Lorain County, we have a higher vaccination rate, and we have lots of great hospitals, right. And so that medical system is really more robust here, so that's been great.
If we could maybe shift gears a little bit, you could talk a little bit about your take on the safety measures and the quarantine protocols that we have here in place in the Amherst schools.
Yeah, so remember, let's say you get 3 or 4 children who get it from family members or whatever, and they come out and get it from the community, and they come into the school. Okay, the concern is they could start spreading that in the school. So when a case comes up and they're in the classroom, again, we start to identify people that are really close contacts and then get them out. And the reason is because you don't want it to spread in the class. Now, you'll still have some spread. There's really no way to completely stop it. But the idea would be is if you can kind of isolate those folks, get them out of school, then again, you can get it to not spread wildly through the school, and that's really the goal.
So, and I know spread is one of those things that it's misunderstood. Could you talk a little bit about what constitutes spread and where those scenarios happen most often?
Sure. So if you think about when your case count goes up in the community, you're always going to have case count go up in the school. There's just really no way around it because, again, family members and other things. So, but when it comes into the school, you may have 1 or 2 children in a classroom, and if you isolate them, get them out of school, and again, anybody who's a close contact, you pull them out, then you know that it won't actually keep spreading. Now, what you'll see sometimes, though, is an event. Let's say you have a classroom setting, or you have a special scenario. Maybe you're doing a particular project where kids are close together, and you may have 1 child turns into 3 or 4 get it in that particular pod, in that small group of folks. And so we'll identify that and say, yeah, here's what actually happened here. Here's likely what happened. And then again, as you pull those folks out, then it doesn't happen again. So you really want to design things like you want to stay separated, and you want to make sure that you're not getting into a situation where someone who's symptomatic is coming to school. So number 1, stay home if you're sick. Yep. Right? That's which
is always applied.
Well, of course, you'd like to think we'd do that during flu season and all the other viruses. Yes. And so that's really an important piece. And then the other piece is if you're a close contact, that's when you need to stay home, or at least monitor your symptoms. Maybe you're in a classroom. Maybe you're a parent of a child who's in a classroom that got notified, hey, someone in the classroom got it. Well, most likely that means that your child doesn't sit near the child who got it. Right. So again, just monitor your symptoms. Make sure that for the next 14 days, maybe it's time to not have a visit to grandma or a visit, especially to an unvaccinated person, because again, you don't want to be that breakthrough case that now spreads it.
I know that total cases is what most people tend to focus on. But I know you have shared with us that there's a lot of variables that drive total case count. And can you talk a little bit about context and how important it is to not just look at total case counts, but the context of which those are occurring?
Sure. So think about it in a couple ways. First, Amherst is a pretty good-sized school district compared to other school districts that may be smaller. And so if depending on the number that you might have, well, that might be the expected number per population, right? As opposed to we have 5 in a particular classroom or we have 15 in a particular school setting, and then that's when our main epidemiologists, we have 2 main ones that deal with this, will be contacting your principal and your folks to say, hey, maybe we do have something going on in a particular classroom. And so we've done that a couple times, and it turns out in some cases there's been nothing going on, and other times it could be something where 3 or 4 kids happen to be in a pod situation and they spread it to each other. And so again, that's where our epi experts can come in and help the school kind of say, hey, you've got something going on and this is what we recommend you do now.
Can you talk a little bit about the reporting? I know that there's a dashboard on the, I think it's Ohio Department of Health website, and of course there's case counts that are displayed there, and again there are variables that impact those numbers as well in terms of if cases are reported, a lag in reporting. Can you speak to that data that appears on the Department of Health website?
Yeah, so that's a pretty imperfect system, and so this was designed last year to try to help parents to at least get a handle on how's it going in the school. And so once a week we get all of the spreadsheets that come from any of the different schools on cases that they have, and then we report that up to, on Tuesdays we report that up to the Ohio Department of Health, and on Thursdays they populate their page. So if you had a few extra cases on a Wednesday or Tuesday afternoon, they may not get posted for another week. So in other words, your parents may say, well, wait a minute, I know that we just had 4 or 5 kids because I just got notified. Why aren't those on the website? Well, that's why. The other big thing that happened this year, and it happened with a couple of neighboring districts, was that the reporting went to 0 again in mid-August, because they wanted to take off last year's reporting and go to 0 and then start reporting again. Well, some school districts started school before then or had some pre-work done before then and had a few cases, and so those aren't counted in the main number. And so you'll notice that some districts will say, yeah, we've got X amount of cases, and there's less than that on the ODH website. That's really why. It was just a question of when they zeroed them out from last year to this year.
Okay, thank you. Wanted to talk a little bit about obviously something that people are very passionate about. I think currently I believe there are 7 districts in Lorain County that are strongly recommending masks for students that are unvaccinated, but not requiring it. And I assume your guidance is still that students that have not been vaccinated are strongly encouraged to wear a mask. Is that correct?
That is correct, yeah. And parents need to be thinking about this. So if you're 11 or under, obviously you can't be vaccinated. And so how do you protect your child, and what should you do? And so, this whole disease is going to move from an emerging infectious disease to an endemic disease. We're going to be continuing to move in that direction. So that's a disease that's around, and you have ways to protect yourself from it. Vaccine, or again, other ways, wash your hands, cover your cough, stay home when you're sick, basic stuff, right? And so as we move towards that, we're going to continue to see more and more safety guidance, just to say, moms, dads, this is what you should do. And so again, when we look at kids who aren't vaccinated, it's a good idea to wear a mask, because you know that you can actually stop some or control some spread. Now, some districts at the beginning said, listen, there's no way I can do this without just mandating it. And so some did. Others said, hey, we're going to highly recommend it. We're going to see what kind of compliance we can get, and then we'll see if it's spreading in the schools. And others said, okay, well, let's just keep monitoring the school, and if it gets to it, then that's exactly what we'll do. And so, again, as a health commissioner, I can't come in here and say, you will do this, and I have to say, listen, this is where it makes sense, and this is how you can protect your child. And that's really what we've kind of focused on. And each district has kind of decided, okay, this is what fits best for our district, and this is the best way to do it.
Okay. In closing, Dave, is there anything that you would want to share with the Amherst community as it relates to this pandemic that we're in the midst of? Anything at all?
Yeah, so there's a couple things. You asked about the hospitals before, and children, there's more diseases than just COVID, and we tend to get COVID-centric. And we had a case of a small child with RSV, and you may have heard of RSV. It's a respiratory virus, and it is really causing some problems with small children, and it is, extremely difficult to deal with, as a child. And so, again, I want everyone to understand, COVID's a concern. But there are other diseases out there that we also need to be worried about and we should be thinking about. And one of the reasons some of the children's hospitals are struggling right now is they have a lot of kids with RSV in the hospital. And so now if you add any COVID kids to that, now they're struggling with the capacity. And so it's more than just COVID. And I know we get COVID-centric, and people tend to really I have a strong opinion on this or I have a strong opinion on that, as opposed to let's look at this and say this is a disease that we're going to have to deal with for the coming years, and ideally as more people get vaccinated and more people get it naturally, it'll just get more and more mild over time. So I know a lot of people are emotional about this. My only suggestion is this: take a deep breath.
Yes.
Understand that there is risk out there. There's no question there's risk out there. Do the best you can to mitigate that risk and keep moving forward. And that's really my message. I tried to have that message through the pandemic of what's a real risk and what that risk level is and how to reasonably handle it. And that's what's important.
Well, in closing, Dave, I just thank you so much for your willingness to be on our program today, and thank you so much for your expertise and the work that not only you but your staff is doing at Lorain County Public Health. We very, very much appreciate the partnership, and we appreciate all the work that you're doing.
Thanks.
Thank you again, Dave. And in closing, thanks most of all to you, our viewing audience. And at any time, if you ever have any questions as it relates to the Amherst schools, please feel free to give us a call at the board office. That number is 440-988-4406. Thank you again, and go Comets.